Hello. Today we're going to be discussing Cath Lab patients in the cardiac PCU. We will be discussing the nursing responsibilities and clinical considerations related to caring for this type of patient. And we will also be taking a look at the PCU Cath Lab admission checklist. Hopefully, this information will help you to better understand the medical management of cath lab patients and the process of transferring them to and receiving them back from the cath lab so that we as PCU nurses can work more cohesively with the cath lab team to promote efficient patient flow and ensure our patients and their families have positive experiences at Norton Children's Hospital. These are our learning objectives. By the end of this video, you will understand the updated anesthesia NPO guidelines. You will understand medication modifications required for patients going to the cath lab. You will know commonly required pre cath lab tests. You will understand when to call report for patients who are first case in the morning. You will understand nursing responsibilities while preparing patients for cath lab and when receiving admissions from the cath lab back to the PCU. And we will review the PCU cath lab admission checklist. These are the updated anesthesia NPO guidelines. So for clears, we're going to stop giving these 2 hours before the procedure. So this includes water, Pedialyte, Gatorade, Powerade, apple juice without pulp, and Jello. For breast milk, we're going to stop giving this 4 hours before the procedure. So this is unfortified breast milk without additives. Formula or non human milk, we're going to stop giving this 6 hours before the procedure. And just remember that added thickeners, fiber, or MCT oil are all treated as solids. And in solids, we're going to stop giving 8 hours before the procedure. So solids include fatty, fried, or meat containing foods, Pediasure, and protein shakes. Medication considerations. So we are going to hold all medications the morning of the cath unless listed below. Hold aspirin and Lovenox the morning of. Hold enalapril, Epined, Entresto, lisinopril, losartan, benazepril, or any form of ACE inhibitor drugs or angiotensin II receptor blockers, ARBs, for a full 24 hours prior to the cath procedure. Hold Farxiga or other SGLT2 inhibitors for 3 full days prior to the cath procedure. Hold Eliquis or Xarelto for 3 full days prior to the cath procedure as well. It is okay to take Synthroid, anticonvulsants such as Keppra, and pulmonary vasodilators, sildenafil and bosentan, unless that's specifically discussed with the provider. Antiarrhythmics, sotalol, flecainide, metoprolol should likely be given, but you all can hold these if there are concerns. And then we're going to hold warfarin 5 full days before the cath procedure and bridge with Lovenox while temporarily off warfarin. Pre cath orders, tests, and labs. So we'll need an active type and screen, a CBC the morning of or day before, an IV in place. So the primary team will place the appropriate NPO and IV fluid orders, a urine HCG. And then interstage single ventricle patients will need to have a recent echo. So PCU nurses, pay attention to this detail specifically. You need to expect to give report around 7:20 to 7:30 a.m. and then immediately take the patient to cath lab holding if they are the first case. Cath lab patients coming back to the PCU and aftercare. Excuse me. So flat time is 4 hours, then activity is tolerated. This will be ordered per the post cath order set. If we per close, it's only 2 hours flat time, and the post Cath orders will reflect this as 2 hours. Patient can resume home meds the evening of the cath if deemed appropriate by the medical team, and then we'll obtain a morning EKG. And again, this will be ordered if needed. So we'll do this for ASD, device closure, and valves. An echo is always obtained for ASD valves the morning after. Other cases will be case dependent. You may change the pressure dressing to a band aid at the 24-hour mark post cath, and then keep the band aid on for 3 days, and no submersion of the leg for 3 days. If it's a new device, i.e., an ASD device, we will take care of booking the follow up, but that may or may not be in Epic prior to the discharge. New hardware will also require 6 months of SBE prophylaxis. So, for single ventricle conduits and transplants, this may actually require intermittent lifelong prophylaxis as well. So, this is the PCU Cath Lab admission checklist. Before the patient goes to Cath Lab, you need to have consent to operate without definitions printed and on the chart at the bedside, a consent for anesthesia printed and on the chart at the bedside, 2 CHG baths completed, send the patient in clean gown and linens, which we will do when we give the CHG baths, 2 wristbands on the patient, and then make sure to verify the correct patient name with patient identifiers. Be prepared to transport the patient to Cath Lab, and then make sure that you complete the pre-op checklist in Epic. PCU Cath Lab admission checklist continued. So while the patient is in Cath Lab, we're going to assess the room stock. Remember not to overstock the rooms with supplies. And then while the patient is gone to Cath Lab, have a discussion with your charge nurse and ask if the patient needs to move rooms or have a terminal clean. If yes, then you're going to send a new warmer or bed to Cath Lab for that patient. Post Cath Lab. So when your patient comes back from Cath Lab, you're going to notify the UC of the patient's return so that they can flip them back over to our floor in the system in Epic. Release your signed and held orders from your providers. Typical orders, you're going to have vital signs, pulse, and perfusion checks every 15 minutes times 4, Q 30 minutes times 4, every hour times 2, and then the 15-minute checks will usually be done when the patient gets back to the PCU. Activity level order, flat time, bed rest, and then also you'll have orders for the cath site dressing to stay on for 24 hours. That's all I have. Thanks so much.